So we're seeing black fungus cases on the rise across the country with more than a 30% mortality rate. But it's time now to decipher the reasons behind this deadly fungal infection. Here's all that you need to know.
Several studies have been done around black fungus, each one of them opening up a plethora of possibilities surrounding this infection. The first series on black fungus mucormycosis, done by Professor V.P. Pandey in Indore on 210 patients. Interestingly, it reveals while antibiotics was used in 100% patients, steroids, the suspected culprit behind the increase in cases of this infection, was used only in 14% of the patients. 21% of them were not even diabetic. Interestingly, zinc supplement intake was not checked. Clearly, there are factors beyond steroid use and diabetes here. The obvious question is, what other forms of treatment did these patients receive? Experts are now even saying excessive steam inhalation, a widespread practice in India, could be one of the reasons.
High temperature steam in large amounts taken excessively can damage the mucosa or the lining of the airways, and this has already been documented. One must be careful in doing over-enthusiastic steam inhalation.
Burns caused 10 to 20% of past mucormycosis in India, say experts. Trauma to skin or mucous membrane can trigger invasive fungal infection in the right settings. Experts are now saying that potential offenders that must be looked for in studies is the concurrent use of antibiotics, which is not required in viral infections like COVID-19. Azithromycin, doxycycline, even carbapenems are seen on prescriptions. Antibiotics are known to increase the risk of fungal infections. Predictors of hospital-acquired bacterial and fungal superinfections in COVID-19, a prospective observational study done by Professor Marco Falcone from Italy, University of Pisa, says the same. Also, a research paper called Epidemiology of Mucormycosis in India says that incidence of mucormycosis has over the years increased in the country. This has been published in the medical journal Microorganisms. It says that the computational model-based method estimated a prevalence of 14 cases per 1 lakh individuals in India. The incidence seems to have grown amid the COVID-19 pandemic. The black fungus infections went up 2.5 times last year between September and December across 16 centers in the country. Another research, Diabetics and Metabolic Syndrome, suggests the unholy trinity of diabetes, rampant use of corticosteroid, along with COVID-19 that appears to increase the occurrence of mucormycosis, a rare black fungus infection.
In this paper, we have collated data of all the cases of mucormycosis in the world, starting from beginning of the COVID-19 epidemic. We have found 101 cases, out of which 82 cases are from India. So India already, before COVID-19, India already had a lot more cases of COVID-19 than rest of the world. There were further highlights from this paper. Number one, that it is seen more in males, 80% in the males. Also, the steroids are much talked about, but the steroids were not given in all the patients. Only 80% of the patients received steroid, 20% did not. Diabetes, which is also much talked about, was present in only 80% of the cases. Also, diabetes with very severely high blood sugar, ketoacidosis, was present in 15% of the cases.
Mortality was noted in 30.7% of the cases. Globally, the prevalence of mucormycosis varied from 0.005 to 1.7 per million population, while its prevalence in India is 80 times higher, which is 0.14 per 1,000 in India, compared to developed countries as per a recent estimate. In New Delhi, Sneha Moldani for India Today.